Welcome to another video of Zilla. In this video, we're gonna talk about the basics of ulcer. The purpose of Team Zilla is to aware the public about the common diseases. You must stay aware to stay safe. A peptic ulcer is a sore on the lining of your stomach, small intestine or esophagus. A peptic ulcer in the stomach is called a gastric ulcer. A duodenal ulcer is a peptic ulcer that develops in the first part of the small intestine, also called as duodenum. An esophageal ulcer occurs in the lower part of your esophagus. The most common causes of peptic ulcers are infection with the bacterium, called Helicobacter pylori, and long-term use of non-steroidal anti-inflammatory drugs, NSAIDs for short, such as ibuprofen and naproxen sodium. Stress and spicy foods do not cause peptic ulcers. However, they can make your symptoms worse. Common causes include a bacterium. Helicobacter pylori bacteria commonly live in the mucus layer that covers and protects tissues that line the stomach and small intestine. Often, the Helicobacter pylori bacterium causes no problems, but it can cause inflammation of the stomach's inner layer, thus producing an ulcer. Regular use of certain pain relievers. Taking aspirin, as well as certain over-the-counter and prescription pain medications, called non-steroidal anti-inflammatory drugs NSAIDs for short, can irritate or inflame the lining of your stomach and small intestine. These medications include ibuprofen, naproxen sodium, ketoprofen and others. They do not include acetaminophen. Taking certain other medications along with NSAIDs, such as steroids, anticoagulants, low-dose aspirin, selective serotonin reuptake inhibitors SSRIs for short, Alendronate and risedronate, can greatly increase the chance of developing ulcers as well. Symptoms of peptic ulcer include burning stomach pain, feeling of fullness, bloating or belching, intolerance to fatty food, heartburn, and nausea. The most common peptic ulcer symptom is burning stomach pain. Stomach acid makes the pain worse, as does having an empty stomach. Many people with peptic ulcers don't even have symptoms. Less often, ulcers may cause severe signs or symptoms such as vomiting or vomiting blood, which may appear red or black, dark blood and stools, or stools that are black or tarry, trouble breathing, feeling faint, nausea, or vomiting, unexplained weight loss and appetite changes. In addition to having risks related to taking non-steroidal anti-inflammatory drugs, NSAIDs for short, you may have an increased risk of peptic ulcers if you smoke, because smoking may increase the risk of peptic ulcers in people who are infected with Helicobacter pylori, or if you drink alcohol, because alcohol can irritate and erode the mucous lining of your stomach, and it increases the amount of stomach acid that is produced, or if you have untreated stress, or if you eat spicy foods. Alone, these factors do not cause ulcers, but they can make ulcers worse and more difficult to heal. You may reduce your risk of peptic ulcer if you follow the strategies recommended as home remedies to treat ulcers. It also may be helpful to protect yourself from infections. It's not clear just how Helicobacter pylori spreads, but there's some evidence that it could be transmitted from person to person or through food and water. You can take steps to protect yourself from infections, such as Helicobacter pylori, by frequently washing your hands with soap and water, and by eating foods that have been cooked completely. If you regularly use pain relievers that increase your risk of peptic ulcer, take steps to reduce your risk of stomach problems. For instance, take your medication with meals. Ulcer can also be prevented by avoiding drinking alcohol when taking your medication, since the two can combine to increase your risk of stomach upset. Treatment for peptic ulcers depends on the cause. Usually treatment will involve killing the Helicobacter pylori bacterium if present, eliminating or reducing the use of NSAIDs if possible, and helping your ulcer to heal with medication. If Helicobacter pylori is found in your digestive tract, your doctor may recommend a combination of antibiotics to kill the bacterium. These may include amoxicillin, clarithromycin, metronidazole, tinidazole, tetracycline and levofloxacin. Proton pump inhibitors (PPIs for short) reduce the stomach acid by blocking the action of the parts of cells that produce acid. These drugs include the prescription and over-the-counter medications omeprazole, lansoprazole, rabeprazole, esomeprazole and pantoprazole. Acid blockers, also called histamine blockers, reduce the amount of stomach acid released into your digestive tract, which relieves ulcer pain and encourages healing. Available by prescription or over-the-counter acid blockers include famotidine, cimetidine and nizatidine. Your doctor may include an antacid in your drug regimen. Antacids neutralize existing stomach acid and can provide rapid pain relief. In some cases, your doctor may prescribe medications called cytoprotective agents that help protect the tissues that line your stomach and small intestine. These include the prescription medications sucralfate and misoprostol. And with that, I want to thank you for watching. I hope you found this video useful. See you in another video. Stay aware and stay safe.